Hello everyone, this is Chris Sotolero for EMS1. And you know, one of the things I've always noticed as a paramedic is I always seem to have trouble getting into my kits. Things get lost, things get soiled, things get ripped open. And I think our friends from Care Emergency Management Systems has come up with a great solution. I'd like to go ahead and introduce Mark Bainbridge. He's the president of Priority Care. How are you doing, Mark?
Very good, thanks.
Thanks for joining us. So you have some really great kits that I want to talk about. Maybe you could share a little bit with them. First off, your company is in Australia, and this is an Australian design.
It's an Australian design, and these kits have had a track record in Australia for the last 15 years. And the designs have developed over that time, and nearly every ambulance service in Australia structured very differently from the US. However, basically the equipment's the same, and the organisation is throughout Australia. So I thought I'd bring it to the States.
And we're really happy you did. So tell us a little bit about them. What makes them unique to the kit world?
Okay, well, the very first thing is the point of difference is not so much outside the kit, but inside the kit. It's the organisation. I'll give you an example.
Yeah, let's see them.
This is an airway kit, or an airway roll, as often said. The first thing you'll see is the materials are different on the outside. They're very rugged materials, very durable, but they can be wiped clean, disinfected, impervious to blood and fluids.
Which is really important because when you're dealing with the airway, you don't know what you're going to get on there. And
exactly.
You're going to soil your kits.
But internally, the kits are laid out in an organisation that is very apparent, it's very ordered and logical. So in order of procedure, every piece of equipment has its own spot, it's held in place and secured. I can pick this kit up and nothing will fall out.
That's awesome. And I think one of the things that's big points to this is, as you said, this goes in order. So I could take the handle out, choose the blade I want, and I kind of have everything in an order of the way I'm going to use it. I think that's laid out really outstanding. I'd be able to find things very easy here.
Well, location is very important to find things quickly, especially when you've got a patient and time is of the essence. We know seconds count, and you don't want to be fumbling around, especially if it's in the dark or a road accident where you can't see. When it's laid out in an organised fashion, seconds count. It saves.
Now, is the airway kit the only one you have?
No, we've got a full range of kits, and they're basically task specific. So as we saw, that was grey. We make all the drug kits are yellow. And once again, internally, this is a drug and IV kit. So we've got the IV section. We start from here. Tourniquet, cannulas, tape, tegaderm, syringes.
Again, outstanding in the fact that it goes from the order of the way that we're going to use them.
And then we go to the drugs.
Oh, what a great setup we have here.
Now these drugs, we label them. That's part of our service. So these drugs are labelled. We can also date the drugs.
Oh, that's excellent. I mean, because you don't know how many times you wind up going into a kit and the drug is expired. So that'd be great to have.
And when this is full of the ampules, it resembles a machine gun belt where every hole is filled. Now you take one of the bullets out and it leaves a gap. So it's a bit like here. We go to a job and we use items. Visually, we can restock this kit because we can see
because we know what we've used.
So there's a little bit of inventory control built into these kits. It's a logical setup. It saves time for training. I think you mentioned, you know, new officers coming on the block. This is very easy to work in, very easy to restock, very logical in sequence.
You know, Mark, one of the things that I wanted to ask you, if we can go back to the drugs, is a lot of times you'll find nowadays that manufacturers are changing drugs. Like I'm used to using a vial, but now I may have to go to a pre-filled. How does that work with your bag?
Well, we keep this bag maintained and up to date, and drug companies do that a lot, I know.
Oh, what a great thing. So you can just change the filling and...
Well, if you take a photo, send us with the size of the ampule, we create the customised loop.
And goes right back on there.
And you don't have to change your whole kit just because the drug companies decide to change their drug.
Well, I think that's a really great feature. Is there anything else in this bag that really makes it unique?
Yes, when we talked previous about replacement ambulance officers and training ambulance officers,
right.
With every one of our kits we provide a layout guide, and we can put the service logo there, and,
that's awesome.
You've got an instant inventory checklist, and of course if things are out of place, even a newbie will be able to tell that it is out of place. So wipe clean material, impervious to blood, water, and we've got some other features. In that, I'll show you in the bigger bag.
And so we have another kit to look at. Let's go ahead and pull that up here. And I think folks are going to really enjoy seeing this.
That drug kit fits in the lid, and so does the airway kit. This is our largest kit.
And I think one of the things that I notice about this is it's very, very streamlined, and it looks like it would be very ergonomically correct.
That is one of the major features of our kits. They have all ergonomic principles in their design. Basically, the closer they are to the spine, the less pressure. If it's a wide bag, we end up pushing in on the spine, distorting the spine. And if they're not designed properly, you're going to strain the shoulder and the back. So this sling, ergonomic design, wraps around the shoulder, has a neoprene material on the inside, so it grips onto material, doesn't slip off. It also has a backpack.
Oh, really? Oh, wow. They're hidden straps that will allow us to put us on to carry them to those longer distances that we have to work from.
And it's also still padded, this particular method.
And one of the things I noticed first, Mark, which I think is very beneficial, is it's very streamlined against your body, that it won't be catching on anything as you're walking with it.
That's right, especially if you're coming through narrow doorways in ambulances or narrow doorways in buildings. So it's got a narrow profile, and it's very easy to not only deploy, but also take off.
So will this allow us to kind of interchange compartments as well?
Yep, probably the last thing I could show you in there. Inside we have all these dividers can be moved around so you can group your equipment in a more logical sequence, and it's of a depth where you can't keep dropping stuff in, so it's a bit like a vertical file, and by doing that there's no issue of pulling out a whole heap of equipment trying to find what you got on the bottom.
How easy is it to change the materials that's up front?
Well, they're all velcroed in. This whole panel can come out, it can be washed, decontaminated, can go through a wash. We've also got a couple of variety of panels. That's a trauma panel.
Oh, wow. Excellent.
We could make it an IV panel with the drugs in boxes if they're still carrying it. And we also have an airway panel. So you can make that a task-specific bag. It comes in 3 different colours, so you can actually colour coordinate your kits according to their task and put them in your ambulance. So once again, we come back to that training point, very easy for assimilation and standardisation across the service.
I got to tell you, what a great product, and I appreciate you bringing it to the United States, and I look forward to seeing them out in the field.
Thanks,
Mark Bainbridge, thank you very much for joining us.
Thank you.